More controversy about health care this week. The U.S. Supreme Court ruled 5-4 in favor of upholding President Obama's reform plan called the Affordable Care Act. The rollout continues through 2014, but it's already sparking much debate. The Republicans are outraged. They're calling it unconstitutional. Well, joining us today once again is Dr. Daniel Ladd. He's a local dermatologist to offer his opinions on the impact of the ruling. Thanks for sticking around this morning.
Thanks for having me.
Once again, let's run down the bullet points of the Affordable Care Act.
Sure. Let's do the good news first.
Okay.
The good news would be, the pre-existing conditions ruling for insurance is going to make it easier for patients that have severe conditions to get insurance. So that's a good thing. A lot of people agree that's not a big debate issue.
Okay.
And then, the fact that more people are going to be able to get access to insurance care is a good thing.
Right.
What's up for debate, the thing that the Supreme Court was looking at was the individual mandate, which kind of forces people to buy insurance, whether they want to or not. Currently, if you're 18 years old or whatever, if you feel healthy,
you want to take that risk.
Why should I spend the money on that?
Sure.
Hey, now you kind of have to. So that's the thing that sparked all the controversy. And then, on the financial side, there is some financial uncertainty for physicians with the Independent Payment Advisory Panel, and also the fact that the law didn't really repair the flawed physician payment plan. And that doesn't sound like a problem initially, but it actually is, because if there's uncertainty in these private practices that are out in rural areas of Texas, then they worry, about what's going to be the outcome for patient care, specifically over 65 Medicare patients. What are they going to do if their doctors can't keep their doors open?
A huge concern for this rising cost in health care. From a physician's perspective, how does this Affordable Care Act look?
Well, it's kind of a contradiction in some ways, because the idea that we're going to have more people insured is a good thing. Sounds like a great thing. However, if you're a small business owner and you're paying for your employees to be insured, every year it goes up 5%, 5%, 5%.
Right.
And as a small business person, it's going to be one of those big challenges for you to kind of even that out. So it sounds good, because a lot of people covered. But then, what's the reality of that?
Right.
The other thing is, if you're going to mandate that people pay, some people just aren't going to be able to anyway. They'll face a penalty, but will that be enough to get, you know what I'm saying? Will the penalty be less expensive than actually paying for their insurance?
Right, right. A hotly contested debate here with the Affordable Care Act, and we'll continue to follow it. Again, it rolls out through 2014, so people are going to have a lot of time.
Oh, plenty.
To talk about it. Dr. Ladd, thanks for joining us
Hey, no
this morning.
problem. Thanks for having me.